Here we go. Welcome everybody to another episode of The Big Idea. I'm Dr. Jeffrey Hanna here with Clear Chiropractic, where we talk about the big idea, how it is a little bone at the base of your head can have a profound impact on your health, your well-being, and can change the quality of your life. And what we're going to do here, hopefully a relatively short video, but we're going to have a look at an MRI that a gentleman had requested me to have a little bit of a look at, to share with you a few of the things that I saw. In brief, he was experiencing neck pain, and he's been having neck pain for quite a while, but things have only relatively recently started to ramp up. And he was wondering, does he need surgery? And so I want to show you what we see on his MRI and what it means. All right, so I'm going to share this because I know that this is a common question for a lot of people. They want to know, what kind of care do I actually need? Do I have to go to the nth degree of, having fusions in the neck? And I will say this, as a general rule of thumb, the best surgeons out there, they want you to be able to try any conservative option that you can first, whether it's chiropractic, acupuncture, physical therapy, massage, doing what you can so that you don't have to go down the surgical route. As a general rule, unless you're dealing with like broken bones and things like that, which is going to require an immediate intervention, a person is generally not going to be a surgical candidate until you start losing complete feeling in your hands, or you're simply put not even able to move your arms. You're dropping things just seem way, way, way too heavy. As painful as it can be having numbness, burning, tingling in the hands, that usually in and of itself does not require surgery. Yes, if you've tried all the conservative options first, maybe, but that surgery should not really be a first attempt there. So what I want to show you is what this fellow's MRI looks like here. And as a little bit of point of reference here, what do you need to know? You need to know that what we're doing is we're looking at the neck in a side profile view. So the top vertebra would be right up here. Here's the C2, C3, C4, C5, and so forth like this. Now, the bright white that you see, and this is going to be important, bright white is water. In particular, this is going to be the cerebrospinal fluid. If we go up just a little bit higher, we would see that the brainstem is located right here. So here would be the pons, it's a relay station. Here's the medulla, this is where all of your vital life centers are. Here's the cerebellum, this is the primary fine motor coordination tuning system. And then you can see this black thing here. This is going to be the spinal cord coming down like that. Ideally, what we like to see is we like to see this bright white area with this nice cushiony area all the way as it comes down through the middle part of the spinal canal like this. And my guess would be, even if you do not have any training whatsoever with MRI, you can probably see that that ain't happening down through here. If I just go back and forth a little bit, there's a good image of it right there. This is not exactly midline, but what you can see is you're coming along the back of the vertebral bodies here. This black thing is starting to stick out. That black thing is the disc. It's the disc in particular between, in this case, the 2, the 3, the 4, the 5, between the C5 and the C6 vertebrae right here. And this in the neck is the most common area where we are going to see degeneration of the cervical discs. Well, why is that? It's because the C5 represents the keystone of the normal arch of the neck. When we have head-neck injuries, it's this area that's most likely going to bear the brunt of that. And over time, it will start to whittle down wear and tear. Now, there is that common expression that people say, it's like, oh, I popped a disc, in my back or in my neck. Well, a disc has about the same consistency as the tires on your car. They are very firm. They've got a little bit of give. And my point is that discs do not, unless there's massive trauma, you are hit by a truck, discs do not spontaneously rupture. Instead, what they do is they whittle down little bit by little bit by little bit over a long period of time. I look at this, the overall, structure, the nature of the damage, and I can say that, okay, this did not happen overnight. In this particular case, this is a process that occurs over the span of about 20 to 30 years. In other words, this person who is only in their 40s or their 50s, they most likely experienced some kind of a physical injury going a couple of decades back, and what it's been doing is it's been building up over that period of time, slowly reducing that disc space to the point then where it starts to bulge and herniate out into the back. In fact, if you were to take an MRI of, say, 1,000 people, we're going to find that the vast majority of them do have a certain degree of damage to the discs in the neck. This is a common human ailment, but I will add it is not normal. It's a sign that even if there was an injury where there weren't any broken bones, bleeding, or even bruising, that there can still be damage that happens on the inside. And the problem, as you can see, is that when you have that narrowing right there, that can start to exert tension on the spinal cord itself. The spinal cord is actually supposed to oscillate just a little bit like this. And if we have bulging down here, that acts as a source of friction, rubbing slowly, ever so little bit like this. Now, if you do that for just a couple of minutes, no biggie. But you can appreciate then if this kind of a friction rub, like having a little pebble in your shoe, is going on for a long period of time, you better believe that the accumulative effects are going to start to produce a lot of issues. So neck pain, pain and tingling, burning down into the hands, what's known as, in this particular case, this would be what's known as a degenerative cervical myelopathy. The disc itself is impinging, it's irritating the spinal cord, which is going to be that conduit sending the informations to the brain and then back down to the body. And this particular area is what controls and regulates the sensations that we have in our upper arms and also our ability to move our hands. So in and of itself, I can look at this and kind of see some of the obvious stuff. It's like, okay, yeah, that is not quite right. And in fact, if I was to switch my slice a little bit here, so now what we're doing is we're looking top down. This is the left side over here. This is the right side over here. And if I start to scroll, we're going downward here. You can see that we still have a bit of that nice white water cushion as we go down. But then when we get to that level of that C5 and C7, where did it go? Okay, we have a broad-based disc bulge here, which is narrowing that opening. We can see a little bit of that there. And then it kind of dissolves and disappears as the shape of the spinal canal goes narrow. So we can look at this person, we can easily identify that they have a disc problem that's going on. Now the question is do they need surgery? And again, this is not me diagnosing this particular patient right here, but he can still move his arms, he still has full strength, he has little bits of numbness and tingling into the fingers there. And so it's like, well, surgery may not necessarily be the first line of defense. So what you want to do is you want to see, okay, can you resolve some of the issues that are going on in the lower part of the neck? But what I want to show you now is I want to show you the not so obvious kinds of things that were going on. If I was to come back to this slice right here, some of the things that we're always screening for is evidence where you can have basically part of the brain starting to herniate outside of the canal, being an additional source of pressure. We don't see anything like that going on, so this is good. But I want to change the slice up just a little bit to show you something that I did discover that probably was not being reported on his scan. What we're looking at right here now, we are looking at the base of the C2. So we're looking very, very high up in the neck right now. This is the area that allows you to turn your head. We'll go up in a couple of additional slices like this. So now we're starting to get a little bit closer to the level of, whoops, I'm going the wrong way. Fix that. There we go. Now we're going up. So we're getting closer to the level of the C1 vertebra. And what I want to point out to you is this little circle right here. This is the top of the C2. It's the pivot point, again, as we said, that allows you to turn your head. And then these here would be where the top vertebrae in your neck sit that essentially acts like a cradle so that you can nod your head up and down like this. And remember what we said, white means water. Do you see this little white thing right here that is not there on the other side? This is revealing that there is acute swelling of the ligament that normally supports that structure. In other words, there's not just an injury to the C5 and the C6. There's an injury that is right up at the very top. And the reason that this is important is because the C1 and the C2 vertebra, they normally support the weight of your head and let you move it. If, though, that is knocked off its normal perch and your center of gravity starts to go sideways, something like this, your brain is going to do whatever it takes in order to accommodate for that, because this is the part that's at the very top of your neck. This is the interface between your brain and between your spinal cord. Brain, body, and everything else is going to go right through this area. And it will do whatever it takes in order to protect this. Even if it means, sorry, body, we need you to take one for the team, where the shoulder starts to drop like this and things can start to twist. And I repeat, you can have independent issues going down in the lower part of the neck. But what I'm saying is that if the top part of the neck is not addressed, everything is for naught. The upper part of the neck has to be properly mobile, properly aligned, otherwise stuff lower down can never heal. Now, I can't say if this particular injury is what is contributing toward that lower disc injury in the first place, but this is not something that should necessarily be ignored. It means that if you have treatment that's focused only on the lower neck, it may not actually resolve everything that is going on. Oh, but wait, there is more. So we can see that there is some evidence of an injury up at the top, but I'm going to come up just a little bit higher, and I want to draw your attention to this big black circle that you see right here. What is that? This is what's known as your vertebral basilar artery. I've had a look here, and this is actually the vertebral artery. What are these? These are a pair of arteries that transmit through the neck up to the level of the C1, and then they loop back down and around, and these are what are going to supply blood flow to your brain stem. It's about a third of all of the blood that goes up to your head, but it essentially represents all of the blood supply, again, to those vital life centers. So it comes up through the C1, loops around the back, and then is supposed to join toward the front of the spinal cord, as you would see it right here. But you'll notice that this thing is shifted way off to the side over here. This black circle should be sitting right about here. Now, granted, there could be something that's, to be said about anatomical variations. My point is that, okay, if this thing should be all the way located right here, and have a note, as I go down like this. So here's where those arteries would normally be coming up and joining. Look at how far over this one is here on that right side. You can see this black part coming through right here. This is where it's coming from the neck and it's joining up, but you'll see you're not really seeing any black shadow over here at all. This means that this person, all of the circulation going up to the brain to the brain stem is essentially having to go through that right side. There is not a sufficient amount that's being transmitted through that left side, which so happens to match the exact side of that injury right there. Now, if I was to flip this around here, so here's that black circle as we're looking on a side profile, and we start going up and up and up, you can see there it is right there as it's starting to, there we go, as it's sending the blood up to the brain across here. But on the other side, all you can see is this super duper thin little piece like that. Now, I'm not seeing evidence that that particular artery is actually getting compressed or crushed. So this is a good thing. So my suspicion is that this person has a vascular anomaly. These are relatively common. I have a little bit of something like this myself. It's where one of the arteries is bigger and then the other one so happens to be a lot smaller. But you can appreciate then that if there is something that's going on up at that C1, C2 area, and we do have evidence of that, if that supply is constricted in any way where the brain is going to be needing 100% normal flow, but hypothetically it's reduced down to only 90%, it may not be the point of true blue pathology, but that is going to affect circulation in the brain. And if you start affecting circulation in the brain, this can lead to a number of different things, let alone neck pain, headaches, vertigo, balance disorders, chronic pain disorders, chronic inflammatory disorders. And what it does is it compounds all of the sensations down here. Imagine, if you would, that you haven't slept for 36 hours. Any ache, any pain, any problem that you have in your body is going to be amplified in that circumstance. So what my point here is that even though I'm not seeing the true blue signs of pathology, well, I will take that back. I am seeing, signs of that damage where we're looking at that swelling through that ligament that we see right through here. Something is going on in the upper part of the neck. And if all of the focus is directed only to the lower part of the neck, this person, even if they did require surgery, may not get the full outcome that they were actually looking at. This is why it's very important that when we're looking and trying to take care of the neck, we are doing it from a comprehensive approach, not just looking for the broken bones and the disc bulges and the infections and the tumors and all that sort of stuff, but we're looking to see, is there disruption of the normal functional relationships that could be possibly affecting a person. So a relatively short video for a change. Well done me. But I've done this one here because I know that when people are experiencing neck pain, headaches, balance disorders, they're trying to get a sense of, what's going on. And these, I just wanted to show, are some of the subtleties that can be involved. I hope you've enjoyed this video. If you have, please do click that like and subscribe button. Share this video with friends and family who you think may benefit from watching it. And then if you want a little bit more information, you can go to my personal website, which is drjeffreyhanna.com, where we have all kinds of videos, blog articles that talk about that relationship between the upper neck and how it impacts your health, your well-being. And you can also then reach out to us at our practice. I'm a member of Clear Chiropractic here in Spokane, Washington. You can visit us at clearchirospokane.com or call us direct at 509-315-8166. We'd be happy to have a consultation, have a chat with you, find out if there's something we can do to help. Thanks for watching again. This is Dr. Jeffrey Hanna here at Clear Chiropractic Spokane. Get well, live well, and stay well. Till next time, take care. Bye-bye.